So as a coach in the intensive cardiac rehab program, I'm one of 5 coaches in the program. We have RNs as well as exercise physiologists that follow the patients from start to finish. We evaluate the patients, we put them on an exercise program, and we case manage those same patients for the entirety of the program so that you can really get to know them and make really specific goals and help them accomplish those goals. So I've worked in cardiac rehab for approximately 25 plus years. And working now as a staff exercise physiologist for CIS's intensive cardiac rehab program is unique in itself, is that there's a lot more education involved with the program. We spend as much time with education as we do with exercise, which is important. Every patient, when they start the program, they come through for an intake evaluation. And at that point, we do an exercise tolerance test on them. We design a program that's specific to their needs. Each exercise session is specific for each patient. Every program is individualized. So when each patient comes for exercise, they have access to some of the state-of-the-art equipment, some of the treadmills, new steps, bicycles, strengthening programs. We do individual consultations with the patient, provide what their learning needs are one-on-one. We do it in a group setting, individual, and we also do group strength classes as well as yoga classes for the patients. So as part of the intensive cardiac rehab program, patients not only get to exercise in a group setting, they also get one-on-one consultation with their coach. They have the opportunity to sit with the physician that's going to be supervising for the day, as well as a registered nurse. At CIS, we're very confident that our cardiac rehab program will empower patients to improve their health.